Welcome to Inspiration Radio, Growth Principles for Humanity and Progress. Join us when we share information, wisdom, and ideas how to create an extraordinary future for us all. The future is open. We together decide what will be in it. Welcome to another episode of Winspiration Radio. And today we have the motto Humanity and Progress. A special topic regards to what can we do to health or improve our health, and especially our breathing. We had already this year as a topic breathing, to understand more how important it is and how to do it right. But it's not just about the training. Some people have or born with difficulties and nose, or some have maybe accidents and handicaps then in breathing. But there are solutions, and we want to talk about this. And today I'm very pleased to have Professor Dr. Markus Maaßen from Lucerne, Switzerland. He studied logically medicine he studied in Germany, and very early, already 2000, he started also looking into different technologies, worked with robot technology, and he moved 2006 to Switzerland and is in the HNO Center in Lucerne since then, and specialist in, as I simply call it, face surgery. I don't know if the English terms are totally right, the medical terms. And so I'm very pleased that we have the chance to get some more information, what is possible. And this doctor has also invented a technology in surgery, what nobody else so far could invent, and helped a lot. And therefore we have also one of his patients here in the episode on the radio show, Dennis Geyer. He's also from Switzerland, and he had problems for a long time. And after the surgery, he says he has a new life. So we will hear later from him. So let's start. Thank you, Professor Dr. Maaßen, that you have time just to give us a glimpse of what is possible and why patients like Dennis now has, I can breathe different and have a totally different life. What makes you, to take as a classical doctor education to study so early already kind of different technologies and go in robots? It's not, if I understand it right, part of the classical university journey.
Yeah, well, thank you for the nice and kind introduction. Absolutely right. Scientific approach can be done in a different variety of issues and themes. I went to study robotic procedures application into surgery because I was interested to bring our field of ENT surgery forward. So I studied what can be done, where is a scientific gap which needs to be closed. And fortunately, I found the surrounding at the University of Tübingen to build up a new science group working together with engineers. And so we had a close cooperation with the #1 application science institute, the Fraunhofer Institute in Stuttgart, and they're technology driven. So we took the chance to develop the first robot for surgery. That was almost 20 years ago. Prior to this, I was working in a group to develop the first implantable hearing device, which was in the late 90s. It was the first worldwide implant. So from this technology-driven studies, I decided to go into robotic surgery. And then after this, I tried to develop other applications and to improve surgeries in other fields.
This is very interesting. A robot is maybe a big variety of machines. What could it mean? Maybe most people, when they hear robot, they think it's a kind of artificial human being who's doing the work. Is this not? But I guess it's not that there is now a kind of metal computer doctor who's doing the same work. I guess it's some technology you use for. Is it right? What is exactly the robots?
Right. It's not a man with an iron uniform like a knight in a metal armor standing there and doing some surgery. It was a development. And for it, we have to strengthen this. It was a development. So it wasn't put into the situation where it's applicable for application on human beings. So we didn't go that far. But still, we succeeded to develop a so-called closed loop system, which is a system where you program something into your radio graphic design into your computer, and then the computer is able to make some lanes, and then, for example, do some surgery which is programmed. But this was a development, and after this development was succeeded with its aim, we continued to go into clinical applications.
Mm-hmm. And what are these applications then?
Well, we decided then to stop the robotic development, but to try to focus on other issues. Let's say, what are the issues that are very common? That's breathing. Breathing is one of the most common problems, and it's very, very bothering people. People cannot relax. They have problems with sleeping. There is a tendency that they get thicker because they don't move, and they have concentration problems. All these kinds of problems may be related to breathing, and sometimes they even have head pains. So we then, when I went to Lucerne, I didn't have the facility of a scientific group, but I found it's worthwhile to go forward and try to develop clinical situation to develop a clinical help for people that have breathing problems.
I can really relate to breathing problems. First of all, just recently learned, that's why we had another show about the right way of breathing, because I was from my childhood on, someone was breathing through the mouth, always open mouth, and learned later what big difference it is in the development of jaw and everything, and maybe not protection against flus and everything, because I was not breathing through the nose. But 92, I had then also a kind of surgery because I was also a mouth breather because it was too close. I couldn't really breathe through the nose. That's why I had also in the nights the difficulties to sleep. But that operation must be totally different than yours, what I heard, because it was a kind of hammering, opening it, breaking something away, very painful, and afterwards always going and get all the slime out of the nose. But anyway, nobody really told me how to breathe right then. It was a little bit better, but it was a very painful operation. And what I understand now, you developed something totally different, or a different technique, that it's not only that so painful, like I experience it, and more helpful. So what is it really what you do, or who has the problems? Only those people like me, you had closed, or what kind of range of patients you have?
Well, first of all, I'd like to say it's not invention that makes progress. It's the study, it's the individual situation which is necessary. I had the very fortune to work together with a pioneer in rhinoplasty, which is Klaus Walter. Klaus Walter is one of the most refined teachers which I knew. So we sat together and I said, Klaus, how can you solve this problem? And then he said, well, look at this. Look at how I do it. So I would like to enforce and like to emphasize that it's not a new development. It's just a way to learn from a very experienced surgeon. What are the approved techniques that have been done many years ago, many 20, 30 years ago? And if you go into the literature, you sometimes find something which is very, very successful. You don't have to be the inventor of a new technology. So I'm not the inventor of something very, very special new, but I'm very much convinced of the necessity to go into literature to learn what the old guys did. And it's very simple. You have to copy what the old guys did. There, sometimes it's forgotten, but if you reactivate those technologies, so those surgical techniques, it's worthwhile for the patients. And that's what we did. We just look at the patient and we ask the patient, what are your problems? Do you have breathing problems? Do you have sleeping problems through the night? Do you have a dry mouth? Do you have a dry throat? Do you cough a lot? Do you have a pharyngitis, which are infections of the upper throat? So these are first of all the things you have to ask for. And the second thing is then you have to look at the patient. You have to ask them, did you ever receive surgery before? We have quite a few patients that have received a couple of surgeries. So you have to very, very look at the anatomy. And then if you see, for example, the anatomy, you see a straight nasal wall and a straight nasal septum, and the cavity is very small. Then you develop a solution to enlarge the cavity. And if you have small space on the right and on the left side, then you need to enlarge this. And that's what we did with my former teacher, Klaus Walter. We learned it from him, and we now are practicing this. We're applying this technique here. And the importance is it's not that painful as you think it is. Most of the patients don't have any pain. And interestingly enough, you don't need any tissue, or you don't need any dressing to obstruct the nose. You can you don't have to put a lot of things into the nose afterwards. So no dressing is no tamponade, no dressing is necessary. So it's fairly convenient. And if you're successful with this, the patients are very grateful and very thankful.
Yeah, that's why I believe with Dennis, we will ask him soon. Yeah, made the connection. Says, wow, it can be so different, because when I experienced it afterwards, they put something long on going back deep in. Oh, it was awful. But when you said individual development, did I get it right? You said also I studied and went to the old guys, what they did, and had forgotten that those successful ideas are just not part of the normal education. So the individual development is, so there must be someone who really has the interest to learn more, to do it better for the education. It's not part of the system, so it's always depending on like you're nodding. So it was your interest in being better and have create better solutions and ask other people.
That's exactly right. That's exactly right. Because you have to be curious. You have to be very, very curious. You never should be satisfied with your results. You should ask, why am I able to help 80% of all the people with a general technique, and why do my results in 20% are not that good? So that is the really important question. You have to care, you have to take care not of the good results, but of the bad results. Taking those into consideration, you have to ask yourself, what can I do better? How can I improve those 20% of failures to improve your technique? And you never should be satisfied with what you can. So you have to develop and go further. And starting out from this point, we did a technique with enlargement of the bone. And this can be done with an additional resection. This is taken away of certain spots, only small little spots at the nasal entrance, the entrance of the nose.
Mm-hmm.
We call that an aperture piriform. Aperture is apertura. That's the Latin word for opening, and piriformis is like a fruit. It's like a peach. So that's the opening of the nose. That's where the bones are, and that's where we open up a little bit of the bone. And sometimes we also need to take into consideration where the bottom of the nose is. Sometimes it's a little bit bumpy there, and then you have to look at this. And if you see this, then you straighten out the nasal airflow, which is a very, very individual situation. And then you're on the right track. You can be better than the 80%. You want to reach 95% of success, and that's what we want to do. So we developed those variety of individual applications, and we're happy that it works.
Well, very good. I wrote a book, Millionaire Spirit, and says you always need to look in every area, so whatever consultant, advisor you have, for those who are the 4%ers. We have the 20-80 rules also, and 80% are average or below. And the system, your education system, I studied law, medicine, those who teach there normally don't have the time or don't want to blame someone to explore it that deep, how you do it. It's just maybe a lack of communication that it then one day reaches the university that everybody can learn about it, especially the spirit you're sharing. But that is also in every area. Where are those people who really want to do better, go better and better for it? And then a lot of, like I experienced with my breathing, also meeting a lot of doctors who are busy with the daily patients and have not the time for this individual study. And where I'm more coming from Germany, where you studied in Germany also. It's also this classical system or normal payment. It's not that you have the time really to do it. So what, if it's just a short percentage, what is in the area of that is not so successful? Just system, or people are, will say, maybe not interested. I have my exam and okay, now I go for it. So a lot of lawyers and judges also have not developing their knowledge.
I don't think it's the system, because the system is quite good. We have a broad. I've received a very good training at the University of Tübingen, and I'm very grateful for the things I've learned there. So I would not I would say thank you very much to University of Tübingen. Great university. It's and they gave me the spirit just to continue and to do nasal surgery beyond which is normal. And that's what we want to do. We want to just go beyond the average, and we want to we want to care for patients. We want happy patients. I don't want to have patients that come back a year later and say, "Hey, doc, first 3 months it was okay, but now it's getting worse."
Yeah.
So starting with one of those patients, I was very confirmed. I was very, yeah. I thought, how can I help this patient? The patient said, "Well, 3 months, I my breathing was very good, but now a year passed, and it's not that good anymore." So I started thinking, where does the where does the airflow? Is it like the airflow is straight, or do you have turbulences there, or maybe you have a bump on the bottom? Does it go up and the other air doesn't come in, or if it's too close, too small is the shape? This has a very important thing. If you have a small shape, you need to open it up a little bit, turn around like that, make a little bit round. If you have a round shape, you have better flow. So these are the small things. If you change the shape a little bit, and only 1 millimeter gives you maybe 40 to 80% better airflow. So these are the dimensions. If you think of this and then you care individually, then you have a better success rate, and that's what we need for our patients. And I'm very positive also to offer these kind of techniques, even though to patients that have been treated with 1, 2, 3 surgeries prior to this.
Yeah, I'm getting already kind of curious when I'm back in Switzerland to come and let me check. So I think you were very nice and polite, and but I try to translate it and say, okay, it's so much depending on the individual, whatever profession is, are they really striving after leaving the university for more quality or better technologies and have really the drive to go to the 95% and want to do more, even if they're established in the business already. So that is very important to have those kind of consultants, doctors, etc. And great that you are one of them.
And maybe it's also nice to say thank you to the teachers that have shown you something. I would like to do that in this particular case to Klaus Walter. His nasal surgery and starting out at the university was my chief, Hans-Peter Zenner, which did also good teaching. So if you go back to the roots and you have to appreciate your roots, and then you go a little bit deeper, what are the things that have been invented and maybe have been forgotten in the meantime? Maybe it has been invented 50 years ago, but has been not applied. So you have to think about that. So
Yeah, it's
this is
affordable in all
what
the
brings
areas. If you go to
forward.
this supermarket and see what was in the last 20 years invented, what we could or should eat in the idea of the industry, but what is really working for the body? Yes, so you need to go back to those. And is this also your experience if you go to those, like you said, these old teachers or the old guys who know that they're not so often experienced that someone comes and asks. At least from other areas of professions, I know, okay, very rarely the best are asked, even if they like to share, but it's not that they get a storm of questions from, in your case, from medicine students or the doctors.
Well, um, we do share our knowledge on national and international meetings. There are platforms,
So that is
sure.
what you do from yours, and that would be my next question. Then how you can support the future if you know-how that a lot of people are learning. So you go to Congress, or do you have also like we say in other areas, apprentices who look over your shoulder and learn?
Well, this is also possible. So occasionally we have some visiting doctors in our OR. If they are interested, they can take a look, and I
Mm.
can show and I can show them. Yes, it's they are kindly invited to take a look, and so that is what brings medical education forward. I've been doing this for 30 years now, and I think it's worthwhile to do this because we are training our future doctors, and sometimes when we're old, we're gonna be patients. So it's good to spread your knowledge. So and so I think it's important to share this on a variety of platforms.
Yeah, thank you for that. And before we come now to your patients, Dennis Kaya, let's make short a break. Okay, thank you so far. That was for me at least an interesting warm-up from different areas. And now we come back to your experience and special know-how. And what's it like now to welcome Dennis Kaya, who connected and he had the experience. Um, Dennis is an entrepreneur in different areas. We had once a talk about stem cells, so he knows a lot of different things also in the so-called medical industry. When recently he shared that he had these breathing problems and that he is now expecting a surgery. And I said, oh, I knew about my experience. But he said, oh, no, that will be different. And afterwards, now he shared, wow, a new life. Dennis, if you just shortly explain a little bit what was it, what you're suffering and what happened, how it was to work or be the patient of the professor.
Thank you, Wolfgang. Thank you for having me, first of all. So, yeah, look, I mean, what can I say? I mean, I wasn't expecting a lot, to be honest. In the beginning, I was like, okay, that's I don't know, the fifth surgery now, which will come, and then it will be the same as before. Yeah, but okay, yeah, let's
So
do it
just to
once
understand,
again.
you had 4 surgeries before,
Yeah, yeah, I
but
did four
not the
surgeries.
result where he says, wow,
I had,
now I can,
yeah,
well,
yeah, I had four surgeries. Yeah, three of them, they were supposed to actually solve this problem. Yeah, they should solve that problem, but they never did. So in the beginning, after the surgery, it was okay, not like this now, but it was okay. But then after a year or after 6 months, even it was just shut down everything, and I couldn't breathe anymore, and it went worse and worse. So I have sleeping apnea as well.
mhm.
Sleeping apnea. I sleep with, yeah, I sleep with a machine. I think you as well, right? And it was a nightmare in the nights. I couldn't get, because I have my oxygen. I get the oxygen through my nose. I have the mask with the, with the special thing which you put on a nose, the mask, and I had dry mouth. I couldn't breathe. I woke up because I couldn't get enough air through my sinuses, or how is it called, cavity, through the cavity. I mean, it was just horrible. And yeah, what happened is actually my wife found HNO Center Lucerne. Yeah. And and it was at the Corona times actually. Yeah. So, and we went there, and because she had a problem, she had some angina and some problem with her throat, and we went there, and then yeah, I did also my checkup, and Professor Maaßen looked at my nose, checked me up, and he said, I can solve your problem. And I said, really? He said, yes, because this is a problem which needs a special surgery. Yeah, a very individual surgery, and he showed me all the publications about this surgery, so to give me more confidence, because he saw I'm a little bit hesitant, and don't really believe that. Yeah, so he really convinced me after showing all this, and it just makes sense. Made sense. And but still, I was still hesitant, and I postponed the surgery 1 year, and then finally everybody, my family, everyone said, hey, come on now, do it. And I said, okay, come on, let's go now. I need to do it now, and that's the last time I'm going to do it. Yeah, and after this I will never ever do a surgery again. I just tried the last time. Yes, and I can.
Professor, when you examined Dennis, and so he had already 4 surgeries, and not really a big difference. Is in those cases something kind of damaged already because they need to have done something what you needed to correct, or is it just you go a step further?
Well, with each surgery, you have more scar tissue formation. So from the first surgery to the second is going to be harder because much more difficult. And after 4 surgery, you have very different tissue. The tissue have scar tissue. You need to take this into consideration. So this is the first thing you need to really estimate. And then you have to be honest. Can you solve the problem, and can you be very honest to the patient? Say, well, you have this, and look at this. We can make a special test. We can see from the test where are the problems and where is the solution. We did this testing, and we found that there was an entrance problem, and this entrance problem has not been appreciated in the surgery.
What is entrance problem? That the air can go in the nose?
Yes. It's so it's not that the area has a disturbance or has a problem at the end of the nose. So it's the first 20 to 10 to 20 millimeters. If you have problems there, you have to address this problem. And then we sat together and we said, well, we know you've had 4 surgeries now. It's going to be your 5th surgery, but we believe with a chance of 80% that we can help you. And we said, it's not a standard surgery. You need to cooperate. You have to be a partner of the surgeon. You have to care for your nose. You have to wear special equipment after the nose has been operated on, in order to have control of scar tissue formation. Just remember, scar tissue formation of the nose needs 2 months, at least 3 months, until the nose is stable. Wow. If you don't have an adequate post-operative, this is after the surgery, treatment, what happens? The nose is going to get smaller again. So
Yeah.
you need to keep it large. And I was very fortunate that my patient had an extreme high compliance to do what we suggested. So we are basically a team. The surgeon is not the one and only guy. You have to convince your patient to be a partner. And if you do that, with that partnership, you will have better breathing, even though there has been surgery 4 times ago.
Oh, that's
Like,
very, very interesting. First of all, because maybe just because I had my problems, at least they thought so, and told me more higher. I never thought that apnea can come from entrance problems. So that is very interesting. And how important it is after a surgery, nobody told me also. But it's so
yeah.
logic. It's so logic. Yeah.
Yeah, no, absolutely. Look, I mean, the entrance here, the bottom of my nose, there were so many obstacles, so you couldn't the air couldn't really enter properly into my nose. So it started from there, and then I had a problem on the sinus, on the cavity, because it was too tight, so it had to be widened. Yeah, so on both sides,
Mhm.
2 millimeters. As I
Mhm.
remember right. Yeah, it's 2 millimeters on both sides, each side, and yeah, and I can tell you, it's for me, another life. It's another life. I mean, it's a totally another life, and I wear this one here for the nose. I forgot the name, and yeah, but this one is quite good. I wear it actually almost 23 hours a day. Yeah, maybe 1 hour or 2 hours max. I take it out, but I I I I I put it in my nose because I just want to make sure that it
So
doesn't,
when you say
know.
23 hours, so you're not using the machine anymore.
No, no, I'm using the machine as well because the sleeping apnea is not only related to the nose breathing. It has also different reasons why you have sleeping apnea, and I also have to lose some weight as well and all that stuff. But I use it with my machine, and it's unbelievable. I have a AHI, the AHI value, or the actually the stop, how often you stop while you're sleeping, right? And this is the value you can read on the machine, and it's like between 1 and 2, max 2. It's more. It's like 1.2, 0.9. It's almost nothing. So it's not even considered as sleeping apnea. So I'm below 5. So
Yeah, that's also
perfect.
interesting. Like I said, I never knew about an entrance problem, but Professor, do I understand it right? If there is an entrance problem, the machine doesn't really help because when they're pushing air and you have an entrance problem, it can be even worse. You get more stress because it goes in.
Well, the machine is very nice. It needs to work with high pressure. But what we can do is now we can reduce the necessity to have high pressure, and this
Yes.
is a lot more convenient. By the way, it's also healthier because if you don't have that high pressure, you don't have that high airflow, you don't have that dryness. So it's a
You're
lot.
right. I need to adjust my machine. I wanted to talk to it, but this is another story. I will come and clarify that because I need to adjust my machine because the pressure is too high, way too high now. I feel it, and I need to reduce the pressure now as soon as possible because it really bothers me. Yeah, because it's too much. Before it was perfect, and now it's too high.
Yeah,
Which
because I just learned also recently because I think a lot of my even other physical problems, like you mentioned, from sleep and onwards, depending on the wrong breathing and whatever reason it is for it. And if you really can breathe right and deep, you maybe breathe the top, say, whatever, 4 to 8 really good deep breaths per minute. But as we're not breathing right and it's a shallow, oh, then it's 10 or 20 times or whatever. And there are also the machines push, 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 push the whole night. It's the same rhythm. though in the end it is not really natural or not for the individual really right. So very interesting. Mm-hmm.
Yeah, and just wanted to say, even without this, I can breathe perfectly fine. So I just put it in that, the scars don't grow together and the tissue
Mm-hmm.
doesn't don't grow together. So that's the only reason. So I wear it for 2 months now, almost 2 months. So I will wear it another month just to make sure, it's 100%. And but I don't need it, so I can take it off and I can just breathe normal. Yeah, I can breathe just perfect.
No, even
And
as also, Professor, it's not really for the breathing at the moment, just as meaning that everything grows in the right place and not, uh, yeah, coming together again, so that everything is in order.
yeah,
Right.
it's also it's simple physics. If you have a tube like this,
Yeah.
you want to keep that tube open.
Yeah.
If you have scars, scars contract. And then after 3 months without wearing this, you have something like that.
Yeah.
And certainly the airflow is a lot different from this to that.
Yeah.
So I'm very happy that our patients is so kind to wear these devices because I told him after 3 months, you have a complete scar tissue formation, which is stable.
Mm-hmm.
It won't change anymore. So it's only a temporary issue to wear it for 3 months, and then this will help. This will help a lifelong time. So after this, it's not going to be necessary to wear the devices anymore. And I'm very happy. It's not only nose and breathing. It's more than that. It's your body. It's your concentration. It's your way to sleep.
Yeah.
It's the way you can do sport.
Yeah.
I have a patient. He was 120 kilograms or 130 kilograms. He couldn't move because of his breathing problems. And then
Mm-hmm.
he came back a year later and said, "Well, I have succeeded to move again, and I can manage my body. I've reduced 20 kilos of weight." So we're talking about the complete body, about an open approach to help with the nose and a large amount of issues. And this is very important to see.
Yeah.
Going up the
Yeah.
stairs, we have more power. So
Yeah.
it's a what we're talking here about better life quality.
Yeah.
Yeah, absolutely. I mean, I have power. I stand up in the morning. I wake up in the morning. I feel so strong. I have stamina. I can really. I mean, it's another life. It's a totally other life, and I can really. I recommend everyone, because the problem is the normal doctors. They don't do these customized noses. Actually, this customized solutions. So yeah, I'm really it's really sad actually that there are really not many doctors which are as engaged into this as Professor Mas, because there are a lot of people suffering on this, and they will never know how it is, to live a normal and a good life.
Yeah. That would be good for all. So it's about lifestyle, and when I sent and just Dennis said also his family pushed him to do it. If you feel better, it's not only about your physics or sports or weights or whatever. I guess it also relates and also to a relationship with the family, because if you feel better,
Yeah,
that is really wonderful. So I'm curious, and
thank you.
when I'm back in March, I will knock at your door, Professor. But before we of March, we're still here. I said in the beginning, when I read on your website, you're kind of face surgeon. So at the moment, we're only talking about the nose. And Dennis said also the contact came because his wife had something in the throat. So what else are you doing?
Well, our really we're emphasizing we have a focus. We have a focus on facial surgery. This is the nose surgery with functional reason, as we talked about, and the second uh, broad focus is the aesthetic nose, removal of unwanted anatomies, and we want to make patients happy to have a natural appearance. We don't like that artificial look, but we want to go into, we want to help the ladies and the gentlemen to look natural and to feel better with this. So this is our second large focus. And facial surgery also is a surgery with removal of skin cancers. Just remember that we here in Switzerland have one of the highest rates of skin cancers in worldwide, at least in Europe, because of the mountains, because of the lakes, and so on. So there are varieties of issues. And so to take out the skin cancer and to reconstruct it, to make it look nice then, and to make the people look natural. This is also our third focus as far as facial surgery is concerned. We're doing this, these are the three focus ideas we are stressing our interest on. And to be honest, what is the thing you really want to do? And you've asked other famous people like Bill Gates, for example, you need a focus. You can't be a master of everything. So you need to focus on something. This is the focus in our clinic here at the HNO Center in Lucerne, Switzerland.
Yeah, super. Only with what you call focus, or some others call it also deep learning. You can't really dive into the details and be really then an expert of those things if you try to know everything. So it's really, really important. So would you share some more reasons that I need to take a look at you, or better, you take a look at me when I'm back and see what all can be improved? Because here it's the first time with the cancer in Switzerland, but it makes so much sense. I lived in Gibraltar 12 years, and I moved there also because of the sun. And I could stay the whole day in the sun, no problem. Then I moved to Switzerland, and within half an hour, I got sunburned. How can that be? So I realized in Switzerland, the sun is so much stronger than somewhere else. And is it just the mountains or ozone or whatever? But I can really understand that a lot of people have a problem there. Really, really. So another really important thing to rescue the skin. And we like also, Professor, to share your website here with the interview, and also then later on YouTube. I guess it's okay that more people know about you. Do you have only patients from Switzerland, or I guess with your technique, people come from all over the world?
Well, we have people from Germany. We have also people from other countries, and we have people coming to us for flying in for surgery. They come to Zurich, and from Zurich it's only a 45 minutes ride. And this can be arranged, so it's no big problem. So we have quite a few people from abroad, but we of course have our focus here on the Swiss community, and so it's a very good mixture. We care a lot of the people here, and make people breathe better, look better, and that's our job.
And
Wonderful.
There's one more thing I wanted to say, is the hospital I was in, where I did where Professor Maassen did the surgery, is a beautiful hospital in the mountains. So it's like it's more a holiday actually than a visit in a hospital. I can tell you. So it was totally pain-free. Everything was just perfect. And the result, the most important thing is the result. So I hope a lot of people will watch this, especially the ones which are really totally hopeless, and desperate now, and they should just come to Professor Maaßen as soon as possible to solve the problem, because I know it. I've been through all that, and I can just tell you there is a solution. Yeah, just come to Switzerland. Yeah, that's it.
Very, very good. Switzerland is a beautiful country. And thank you, Dennis, for sharing your personal experience. And thank you, Professor Dr. Maaßen, for your insights and the work you do. And your words from breathe better, look better, and feel better. Wonderful words, I guess everybody is interested in. So thank you that you were on this episode and give some more experience and ahas. And I guess everybody who can listen to this gets the idea, oh, there is chances. There is so much knowledge, even from old guys. So, the best is yet to come. Be inspired.